Hello, friends, and welcome to another episode of Coffee with Tea. I'm your host, Tanya Tyler, and I'm excited because we're going to connect with an old friend of mine, Ms. Barbara Gaynor, and we're going to talk about what she's been up to, since the last conversation we had. So before we get into like what she's been doing and to where she's at, I want to introduce Ms. Barbara to the show. Ms. Barbara, welcome to the show.
Thank you for having me, Tanya. Appreciate it. Great to
Please
be
forgive
back.
me on my tongue tied. We were laughing earlier today, and I'm like, sometimes I get too my tongue gets ahead of me. So forgive me. But we've been in this conversation before, and for those who are not familiar, she had a great episode about hospice, and so a lot has changed since we had that conversation. And so tell me, Miss Barbara, remind us who you are and what you do, and then we can get into what's been going on with you since.
Okay, thank you. So, Barbara Gaynor, nurse and board certified patient advocate. Since my last talk with you about hospice and getting people to know about hospice, I've changed my business from Braddock Legal Nurse Consulting to Braddock Consulting and Advocacy. I added advocacy to that because I've realized that a lot of people have no idea about what's happening with their healthcare and they are not a part of it. So my goal is to help them to navigate the complexities of the healthcare system by educating them and empowering them so that they don't feel like they are intimidated when they go to a hospital or go to their doctor's appointments or anything like that, including even paying their medical bills. You know, there is help out there. So
Right.
that's what I've been doing.
Well, like so I have to say you've been an advocate for um the African American community in general, because I remember from our last conversation about hospice and informing them about, what hospice can do. And now you're like said, you're still an advocate for, I'm not saying all audience, but specifically the African American community, because there's a lot of stuff that we're missing out. So can you tell us a
Exactly.
little before we dive into it, like what made you pivot?
It made me pivot for myself. Earlier this year, I was diagnosed with malt lymphoma of the stomach, which has to do with your lymph system and the lymph nodes in your stomach, that sort of thing. And so I had to go through radiation and all that. But for me, as a nurse and curious as to know what was going on, I did my research so that when I was talking to my doctors, I could have an informed conversation with them. I knew what their treatment plan was. It was either this plan or that plan. I researched what kind of radiation it would be, and we had a good conversation, so my healthcare. So for me, I said, well, there are people out there who don't know, especially our African American and our people of color, who don't know this kind of thing. Now, not just to say it's only them, everybody you know, has this issue, but more so our African American and people of color, that community is not really aware of what services are out there in the community. As I talked about with hospice, a lot of them have no idea. So with the advocacy, I've broadened my horizon here to include them, talk with them, and, just have that conversation with them, because education is empowerment. And you go to the doctor and you have no idea. And I had that experience with myself where my primary doctor did not believe that because I had radiation to the stomach, I was not able to take my regular medications and stuff. And he just shooed me away and put stuff in his notes that I am very, very upset about. But as a friend of ours said, when they go low, we go high. So I went and I advocated for myself by talking to my other healthcare providers who gave me what I needed. So it's about, you don't have to stay with one doctor all the time, even if he's what the new word is, gaslighting you, especially for women. So we have this conversation. So in the future, I'll be having, talks, just 5-minute snippets to just say, hey, do you know such and such, and that kind of information to get out there to them so that they are aware.
Right.
Yes.
Well, like I said, you're always a wealth of knowledge, especially like so that you have a passion with your nursing and stuff like that. So, I know, being a woman of color myself, that we hesitate on going to the doctor. So
Mhm.
what's the biggest thing that you think is a drawback for our community as to not asking questions?
It's the old adage, you trust the doctor to tell you the right thing. And if he says, oh no, it's no big deal, but deep in your gut, you know that something is wrong, that's when you need to have an advocate, even if it's a friend, a parent, or your husband, your wife, or so. But just so you have somebody who can help you to say, no, if this is what's wrong, let's find another way, because there's just not one way. One doctor may say, no, it's no big deal, and another doctor may say, hey, yes, we have to find something. So they hear you. This is the thing. Listening to a patient is key in this healthcare system. And also, you being proactive in your healthcare is number one. You have to be. So you can't be afraid. You can't be afraid of asking questions. The CDC has it out on their website as to what to do when you go to a doctor's appointment. Ask the questions, at least have 3 to 5 questions that are really pressing to you. And don't feel like, the visit is scheduled for probably 20 to 40 minutes. But if you're feeling like it's like, oh, I'm in here for 10 minutes, you've been waiting in the waiting room for however long, you get in there and in two twos of a bunny's tail, you're out the door, and your concerns have not been addressed. So seeing that, for me, I saw that there is a need for people to have somebody to liaison with them. I don't make this as an advocate, I don't make decisions for you, but I want you to be aware of what is happening to you and how you can best navigate this situation so that you do get the best out of your healthcare and your healthcare providers.
Right, right. You
Mhm.
make some really great points, and I'm sitting here thinking like my last time I went to the doctors is amazing. You have all these thoughts, these words in your head before you get to the doctor. You get in there, they start to telling you, this is from your results and this is from your results, and then they sit there and say, "Well, do you have any questions?" And you're like,
You automatically
"No,
say no, but you do.
you do."
So for the inside scoop, which is why you would hire an independent, is to say, okay, when he says, do you have any questions? I can chime in and say, yes. So what is it really that you're saying about her cholesterol level? What does that really mean? Are there lifestyles that she needs to change? Is there anything that she needs? Is there another healthcare provider that needs to be on her team, like a nutritionist, or somebody like if it's for physical, so probably a physical therapy or occupation mental health specialist. All those questions, your body tells the story. Our body is so unique, and it tells you what's going on. You go to the doctor for them to interpret what's happening, and sometimes they don't know. That's why it's called practicing medicine. I mean, but on a serious note, yes, and they do their best. Doctors do really and truly advocate for them. There are some that their bedside manner is not all that hot, but they do good by you. And there are some that are like, well, okay, fine, I don't care. But it is noted, studies have shown that our white counterparts get more time in the doctor's office than people of minority, people of color, and so um, it's just a matter that we have to own our place, know what's really going on, so we can do better for ourselves. you
Right.
know
Right.
and you don't if he says, well, you have diabetes, okay, well, what does that mean? Some people to this day don't really know. They just say, well, it's sugar in your blood, but how does it happen? So my goals usually is to teach you the root cause of what is happening and how you can mitigate that,
Right.
because education is key.
Right. And this is a point where I want to remind everybody that Miss Barbara has been dropping nuggets. So if you've been picking them up, please give us a thumbs up, maybe follow down with a comment below, because she's helping us communicate. It's basically communicating with your doctor, right?
Correct.
And I know you sent me over an information sheet, and I was reading that an advocate can go in and with you and visit you in your hospital and stuff like that. So basically, what's before we really dive into like what you can do and stuff like that, what's a couple of key things that before we go to the doctors we should be, maybe should we write our questions down so we don't forget what is what can we do to prepare, I guess?
Absolutely. So first thing, have at least 3 to 5 questions that you need to address with your doctor. If you are taking medications and all of a sudden you're having headaches or nausea, vomiting, or that sort of thing, you need to write that down. You need to let them know what's happening. You need to let them know what symptoms you are having. I go to a mechanic and I say, my car's not working. Okay, what's going on? Well, I don't know. You're the mechanic. You fix it. Well, the same thing with a doctor. You can't just go in there and say, there's something wrong with me, fix it, if you don't give him the information he needs to kind of put the puzzle pieces together, know which plan of care he's going to be executing for you. So write down your questions, have pen and paper so you can write it down. Ask the doctor if they mind if you record the conversation, because your kids or your husband or your partner is going to ask you, and you're not going to be remembering because you are so dazed with what's happening. And fourthly, make sure that you are engaged in the conversation. Don't just take anything at face value, question it. Because a doctor prefers for you, if you show that you are engaged in your healthcare, your doctor will definitely be engaged with you. So you put in what you get out. So make sure that you have all right. So one, make sure you write down all your questions that you have. You may be gardening and you find that you just get short of breath. Don't shoo it away. That can be something to do with your heart or with your lungs. You're walking and all of a sudden you have a pain in the back of your leg. Don't shoo it. Talk to the doctor. It could be a compression nerve in your back. They call it sciatica. It can be anything, but you don't want to not address everything. Now, am I saying to be paranoid about every ache and pain? No. What I'm saying is when these things happen to you, write down the date, the time, and what you were doing.
Right.
So when you go to your doctor, you can say, this is what it is. Now, if it is a 911 situation, by all means, go to the hospital, get things done. And if you are able to have your questions fresh in mind, or a little piece of paper in your pocketbook or your wallet, then fine, address them with the doctor or so. But make sure that you don't go by yourself. And this thing of secrecy can be devastating. And I'll give you an example. I found out 2 years ago that I was adopted. I did not know. And so the healthcare history that I grew up with is null and void. So I had to research from my new family what my true health history was, only to find out that my biological father, all the illnesses he had, thank you very much, Dad, I have them now. But that's not the history I grew up with. So that's a very, very important factor to know also. So secrets are devastating, especially if you are, having a health crisis and you have nowhere to turn.
Right.
So absolutely,
Right.
absolutely.
You like so you got some good points. You have me thinking about my father because he has COPD, and some days he'll have good days and bad days. But then when I go to the doctors, I'm sitting right next to him. The doctor will say, "Well, how do you feel, sir?" "Oh, I'm okay." But I'm thinking, "But Dad, you just said."
So you
So
talk up, you speak up for him, and then you engage your doctor. Have him ask him what he's eating. Have him ask him, because things can trigger your COPD, your foods, your environment. If you have pets, those kind of things. If you haven't changed the filter in your house, for it, all things, it all ties together. So we just have to be proactive, you
right,
know.
I love it. Like I said, I always love having you on here because you always inform. Get us thinking about the stuff, and that's basically what an advocacy person does, right? Is good.
Yes,
So
yes.
what? So what's the one thing you want to advise people for what you do that maybe they're not really understanding that what an advocate can do for them?
So for me and for other advocates out there, you want to make sure that they are board certified. However, not all of them need to be board certified, but it's like getting somebody who is a mechanic. Would you prefer to have a certified mechanic work on your car, or just somebody who, yeah, he's good, but he might just tinker and get it right or wrong. So yeah, so for me, at Braddock Consulting and Advocacy, I attend physician visits with you, either in person here in Ohio, um, Northern Kentucky, or Southeastern Indiana, or I can do it virtually, be on the phone and stuff. I make a list of questions that you have for your doctor, and encourage you also to make a list of some questions so that there is a conversation going on. And then I can offer a report if you so wish to have a report on that. I can also go ahead and do your medications, organize them. If you're taking more than 5 meds, we need to have a conversation, because is it that the doctor stopped you but you are still taking them, or what's really going on? Because a lot of people, doctors give them new medications but never told them, hey, stop taking so and so, or they don't remember, and so they're still taking it. And so that's it. If you're in the hospital, your loved one or you or so are in a hospital, and you don't think you're getting the right treatment, or you just need somebody there to talk on your behalf, especially those people who live alone and have no family nearby or so, get an advocate to
Right.
help you with that. Educating people about new diagnoses that they have. They have no idea, just like me with my lymphoma. Here, I can do the research, I can figure out exactly what's going on, and then I can give you information so you can talk to your doctor about
Right.
what's really happening. So those are the things. And then there is the dreaded conversations that we have with both parent and child. And well, I want, and no, you that. I can come in the middle and I can say, okay, let's hear what mom and dad have to say. Let's hear what the kids have to say. And okay, kids understand that this is not about you. This is about your parents. We say this too in hospice. This is about your parents and what they want, not what you feel like you should want them to do.
Right.
So having that kind conversation, listening is key.
Right.
So my clients are those families who are solo agers, live by themselves, in long-term care, in assisted living, or in independent living. Families who are away from their loved ones, out of state, and they have no idea what's going on. call me.
I said yeah, great information, and I want to wrap it up. What's the one thing you want people to take away from this interview if they don't hear anything else?
The one thing I'd like people to take away from this right now is to understand that advocates work for you. I'm an independent. We're not covered by insurance, but a lot of us do pro bono, some, but it's more of a out of pocket expense for you. So knowing that, but knowing that you need to have somebody in your corner is key, because you look like a deer in headlights and you need somebody who is staying and right there for you, knowing that they are in your corner helping you. That's
Right.
it. Yeah.
Right. Thank you so very much. And
Thank
here's
you.
my official question, because I know you hinted to it, but please tell us where we can find more information about you, your services, and what you do.
Okay, so Braddock Consulting and Advocacy. We are located here in Cincinnati. Telephone number 513-250-0617. I also have a website, braddockconsultingadvocacy.com. And you can also email me at barbara@braddockconsultingadvocacy.com. I am pleased to help.
And for those listening to the podcast, can you spell it the Braddock part so they?
Okay, so that's B as in boy, R-A, D as in David, D as in David, O-C-K, Braddock Consulting, CONSULTING, Advocacy, ADVOCACY.
She's like, I didn't know she's gonna have me on here as a spelling bee.
Oh no, hey, and some people will say, well, where does Braddock come from? And it's like, I'm paying homage to the street name where I lived in Florida. So, and yes, I moved from Florida to Ohio. I don't regret it.
Well, thank you, Ms. Barbara. Thank you for coming on and sharing more information. And I hope people reach out, because, like I said, you offer a valuable service, and I think it's very valuable. So no matter what your age is, seek a consult or an advocate, because, like I said, I've sit there and like, I don't know. I know, like I said, you have all these words till you get in the office. You're like, I can't remember. So again, thank you for sharing your insight and your wisdom.
Absolutely. Thank you for having me. And I do speaking engagements. So just hit me up if somebody needs me to talk to their group or so. Yes.
Yes,
but
ma'am.
Thank you.
And I want to remind you, thank you again for sharing your insight, and everyone who tuned in, that please, feedback is always welcome. And remember, all the links that Barbara mentioned will be posted down in the description box below. So please check it out down there in the Juice Gems. And if you've enjoyed what Barbara shared today, please give us a thumbs up, hit that like button, let us know we're doing a great job. Or if you have some questions, please follow up in the comments below. Again, if you want to continue getting more of the great insights that Ms. Barbara shared and others, please hit that subscribe button over there. And remember, take things in stride, go with the flow, and create your own path. And we will see you back here on another episode of Coffee with Tea. All right. Bye-bye.